Welcome, everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. First of all, Happy Nurses Week to all of our nurses in Windsor-Essex County. A special acknowledgement to our health unit nursing staff, including RNs, RPNs, and nurse practitioners, and our nurse managers. Thank you for your hard work and the work you continue to do during pandemic. Overall, 11,034 individuals have been tested for COVID-19. Currently, we have 1,761 tests that are pending. For those of you who are awaiting test results for COVID-19, please visit the Ministry of Health's online portal or the link on our website. Please remember that while you are awaiting your results, you must remain in self-isolation. I will now share the most current case counts. There are 68,848 cases of COVID-19 in Canada and 20,238 cases in Ontario. Chatham-Kent has 90 cases and Sarnia-Lambton has reported 200 cases. Michigan now has 47,138 cases, with 9,786 cases being in Detroit. Today, we are reporting 726 cases of COVID-19 in our community, an increase of 21 cases from yesterday. 39% of our cases have occurred in long-term care and retirement homes, including both residents and staff. 275 cases have resolved, 22 people are in the hospital. 17% of the overall cases are between the ages of 20 and 29, 15% of our cases are between the ages of 50 and 59, and 20% of the cases are 80 years old or older. 43% of our total cases are male, 56% are female, and 1% is unknown at this time. Our community has lost a total of 59 people to COVID. 45 deaths have occurred in long-term care and retirement homes among residents. Our health unit is currently working with 15 long-term care and retirement homes that are experiencing a COVID-19 outbreak. Testing for COVID-19 is based on a clinical assessment. Common symptoms include fever, a new or worsening cough, shortness of breath. However, other symptoms may present, such as a sore throat, unexplained fatigue, an increase in falls, nausea, vomiting, chills, headaches. If you're feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local health care provider, a walk-in clinic, or a virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning. Thank you for joining Theresa and myself this Monday morning. Over the past few weeks, the Windsor-Essex County Health Unit has partnered with Essex Windsor EMS and hospital partners to complete mass testing of residents and staff in long-term care home and retirement home. This, of course, has contributed to the large number of pending tests for our community, as well as the declaration of 4 additional outbreaks. I want to assure the public that the Windsor-Essex County Health Unit is working closely with all the facilities to implement outbreak management protocols and practices to limit the spread of COVID-19 in our area. This past weekend, the provincial government lifted existing restrictions for hardware stores and garden store, and today other retailers are allowed curbside pickup. The Windsor-Essex County Health Unit enforcement officers were out this weekend working with local bylaw and police to monitor compliance with public health restrictions and ensure that the initial openings were smooth. While there were a number of lines in traffic, in general, most businesses had put in necessary precautions and followed public health measures to guarantee shoppers' safety. In a few instances, enforcement officers provided education for businesses regarding enhanced safety precautions. Each business and workplace should conduct a risk assessment to determine what additional public health measures should be adopted to address their unique set of challenges prior to opening. Where possible, consider adjusting workplace policies and practices to limit the potential spread of COVID-19. Some of the examples include modifying hours of operation, maintain flexible work hours, and staggering start time of employees. Reducing opportunity for any crowdings by increasing the distance between employees to at least 2 meters in the workplace by moving desks or adding barriers. Limiting the number of clients or customers visiting the workspace at any given time. Continue work from home options. Limit the need to share workstation or workplaces equipment when possible. Stagger lunch breaks. Implement enhanced infection prevention and control measures. For more on how to keep your workplace safely, and visit our website and contact our environmental health department at 519-258-2146 extension 4475. As we continue to open up the province and ease restrictions, I encourage the residents of Windsor-Essex to continue to take appropriate precautions and follow public health guidance. This will help to ensure that we can contribute to our part in reducing the spread of COVID-19 and continue to move forward as a region. Now I'll take a moment to give a big shout out to my colleague first, Theresa, our CEO and our Chief Nursing Officer, and all the nurses at Windsor-Essex County Health Unit and all the nurses in Windsor and Essex. A very, very happy Nurses Week. Thank you for all the work that you are doing.
We'll now take questions from the media. We'll start with CBC.
Good morning. I was wondering, did the health unit or I guess the city receive any calls over the weekend about, garden centers, or do you have an amount of how many calls you received?
No, we didn't receive any calls over the weekend, but our enforcement officers were out there already, and they were monitoring all these businesses, and at some cases they provided some education, but mostly the businesses were in compliance. They had all the measures in place to ensure physical distancing and all the recommendations of public health.
Okay, and I know you said the additional 4 outbreaks were because of mass testing. Are these some of the people, again, that were testing positive but didn't have symptoms?
Majority of them, yes, they don't have any symptoms. As far as I recall, they are all just result of mass testing, and we are investigating those cases as well to identify what additional steps that we need to ensure the safety and well-being of other residents in the facility.
Okay, thank you.
Any questions from Blackburn?
Yeah, just in regards to that testing, have all the long-term care and retirement homes been tested now in the region?
Yes, all the retirement homes and long-term care homes are tested, except for a few which those facilities are testing their own residents and employees. So from our perspective, from our approach, when we are going in and testing those, so that is completed. There are some homes that chose to test their own people and also their own staff. So that is continuing, and we hope to get it all done maybe in the next couple of days or so.
So would you say then the massive numbers of tests that you complete every day are pretty much done? You think just now is the time that we're able to catch up on the pending tests?
That is the hope, because we have done the massive, the biggest portion is already completed. We'll still see additional tests And we have also heard from our provincial lab that they have significantly increased the capacity. I think it was Friday or Saturday, they have reached the max, and they reported it back. They have got good processes in place, so the hope is we should be able to get the results back sooner than later.
Any questions from CTV?
Yeah, I got a couple. So do you hope to get those tests like within a week? So by the end of the week, let's say?
Yeah, so I think I'm anticipating between 4 to 7 days that we should be able to get some of those results back.
Okay, so having said that, do you anticipate, more of an outbreak, in other homes?
Good, because we have done testing in every facility, and based on the definition that we have, it's just one case. And as we know, majority of these people who are in these facilities are asymptomatic at this stage. So even though that they are asymptomatic, but if they come back positive, as per the provincial definition, we'll have to issue an outbreak. And we want to make sure that this doesn't lead to further cases. I think that's the whole idea, being proactive. And but I do anticipate that there will be more facilities that will come back as even a one case in a facility of maybe 200, 300 people. It'll be an outbreak.
Any questions from AM 800?
Dr. Ahmed, how is the virus getting into these long-term care facilities if there's restrictions and lockdowns in place? It's been a number of weeks now where family members are not able to go visit their loved ones. How is this virus getting into these buildings?
So what I can say is, obviously we have to look into how these viruses are getting in. Is probably the support services, the workers, if they're going out in the community, and so I think that would be my best guess, because otherwise the facility on their own, if the residents are not going anywhere, they shouldn't be getting it. But I think despite all these restrictions, there are some movement that happens in the facility. So we need to control that, and we need to make sure that we are restricting all of that movement from in the facility going back and forth.
So, for example, if I work in one of these facilities, shouldn't I not be going out in the community? If I was a family member, I would be very concerned.
Well, when we are working in these facilities, I think that's they need to take precautions every time that they are out in the community. And right now there is no recommendation for these healthcare workers or the individuals who are working in these facilities to just self-isolate when they're back at home. But I think they need to be responsible in terms of how they are moving about in the community, and if possible, if they can stay home, I think that's best. But recognizing that not everyone has that option, and there are essentials that they need to go out and grab. So it's just a fine balance. It's just being more responsible in how you're out in the community and taking precautions, ensuring you're washing hands and using all the appropriate PPE when needed when you're back at the facility.
Thank you.
Any questions from Windsor-Essex?
Yeah, just to follow up to that last question, some of these facilities, they only have residents who have tested positive and no staff. In those types of cases, how do you think it's getting into those facilities?
So there may be, again, could be an asymptomatic transmission that might be happening through the staff or through other service providers, or some kind of indirect transmission that might be happening. In some cases, we cannot say that we have tested all the staff. There are staff that may not be on the shift or maybe out on a different shift and unable to get tested. So there may be a number of reasons that we can see. We also have to look into the possibility of maybe looking at the test as on its the merit of the test too. We haven't heard a lot of concerns about a false positive, but I think when it's all done, the labs, I'm sure, and the epidemiologists would love to sit down and make that calculation too, to see whether we have a false positive possibility as well, and how much of those false positives are out in the community. If we don't see any further spread, if that case was isolated, we may have to look into the case of maybe it could be a false positive, but we're not there yet. We're not treating it as a false positive. Everything that we are getting as positive, we are treating it as a positive.
Any questions from the Windsor Star?
Yes, good morning, Doctor. How many public health enforcement officers does the health unit have?
Oh, I am looking at my team here. That are out there. The 27 inspectors and the those out there that are doing some of these, monitoring of these businesses. So it 27.
Thank you. And employees of long-term care and retirement homes, are they still being subject to temperature checks when they arrive and when they leave?
That's correct. Yeah, it's twice daily temperature check and also review of symptoms to make sure that they do not have any symptoms when at the time when they're entering the facility and when they're exiting the facility as well.
Thank you.
Any further questions from CBC?
Yes. If someone gets tested positive but they don't have symptoms, would that be a person you test again in 2 weeks, or do you just consider them to be without the virus in 2 weeks?
Well, by definition, from a case resolution perspective, irrespective of their symptoms, if they are positive on the day of test without symptoms, so we'll go with the 2 weeks from the day they were tested. So, for example, if someone was tested today and come back positive today, we'll use the 2 weeks timeline starting from today to clear them as resolved.
Okay, thank you.
Any further questions from Blackburn?
No, I'm good, thanks.
CTV?
Yeah, I guess we anticipate this being the week the plateau with the LTCs, because 4 over the weekend, or are you hoping that once those tests come in that maybe this is where we hit the plateau with that?
Yeah, I agree. I think because this week most of the test results will come back, and maybe there will be few that we will see early next week. And after that, we'll hope to see that the long-term care home and retirement home will be stabilized in the sense that if all the control measures are in place, we shouldn't see more cases in those facilities. And then it would be more focused on some of the other like community spread and some other settings.
Any further questions from AM 800?
Yeah, just one. Dr. Ahmed, just going back to what you said earlier about long-term care and the workers there, obviously they're doing a great job, working hard, looking after our loved ones. But if I'm sitting at home and I've been quarantined for 14 days, I'm not allowed to go see my loved one. You're advising us not to go out in the community if we don't have to. But the individuals that work at these long-term care homes, they're still going out in the community to get their essentials, like you mentioned. Shouldn't they have family members grabbing their essentials for them, and once they leave their job, they should be going straight home?
That's what I think is the best option. If they can do that, there are a number of grocery stores I also know that they are delivering at home. So be creative, and I think it's again goes back to the individual responsibility as well, that we have to take some responsibility of our action and how we are interacting in the community. And as long as we are doing that, I think we are good. And we don't know those individual circumstances. If someone is out there and doing some of those groceries, even though that they work in the facility, I don't want people to be concerned and thinking that they're not doing everything. I think we need to take that that they're responsible, and they know most of the they know about the infection prevention and control measures, how to keep themselves safe, and how to carry themselves. So I think it is. They have to be open and looking for all those options that they can to prevent themselves from contracting it in the first place and also transmitting it to the other people. And most of them are doing that. It's some of those, and again, this is just a theory that that's what happening in the facility when you don't have any other type of in and out happening in those in these facilities. So not to say that it's the people who are working in bringing it in. There could be other reason. But just for your answer, they should be looking for all the options that are available right now.
And sorry, one more quick one here. The City of London over the weekend had 0 confirmed cases, 0 new deaths. Just your thoughts on that when you heard those numbers.
No, I think that's the goal. That's where we like to go to, and we want to be in that same in the same situation where we don't have any case, no deaths, nothing. And I think that would be a day that I would be happy about.
Thank you.
Any further questions from Windsorite?
No, thanks.
Windsor Star?
Yes, are you still encouraging staff members of long-term care and retirement homes who are missing the in-facility testing days to go seek out their own testing at assessment centers?
That is correct. I think that's the direction from the ministry as well, that those who have missed the testing blitz because of any reason, they should either go to the assessment center or get themselves tested at the facility that they work.
And then can you sort of re-explain the difference in level of concern between people who are symptomatic and those who are asymptomatic in terms of spreading it throughout the community?
So it's a good question. So I think what we need to do, what we need to think about is an individual's ability to spread the virus. So someone who is symptomatic, and we know that COVID-19 is a respiratory infection. It stays in the respiratory symptoms. Most of the viruses, the highest concentration is in the nasopharynx area. So for someone who is symptomatic with cough and sneezing, those are the ones that have the ability to spread it out into a distance to someone who is either close to them or even in the general environment. For someone who's asymptomatic, they can still have the virus in the same area, but for them to do that, they have to be touching their mouth, nose, and eyes to get the virus in their hands, and then able to pass it on to other individuals in either directly through touching, handshake, or etc., or indirectly by touching a surface or an object that the other person can then touch, and then for them to contract it, they have to do exactly the same. After touching that object, they have to touch their mouth, nose, and eyes. So there has to be more step that needs to happen. If a person is asymptomatic, it would be less a step for someone to spread and transmit it if they are symptomatic. So I think even from both ends, if we are maintaining the physical distancing, and if we are washing our hands appropriately after touching or coming in contact with everyone, washing it thoroughly and often, we are reducing the chances of the spread. And for someone who is feeling symptomatic or have any symptoms, if they're wearing a mask, they're also limiting their ability to spread the virus at a distance. So everything that they may be doing, it can be contained in a small space and wouldn't infect others.
So individuals in long-term who are being newly confirmed positive, most of them asymptomatic, that's why it's less likely that they will spread it because of all the precautions that are in place.
That is the hope, but the indirect transmission is always a possibility, so we'll have to be mindful of that.
Thank you.
Thank you, everyone.
Thank you.